feeling a lot more tightness in the lower aspects versus the top. Drop into my hand as if it's a pillow. Good.
Oh my gosh. I can't. Wow, okay. Yeah, there's a lot of pain.
In through the lower aspect there, right?
Yeah, lower aspect, and I think also like up as well. Yeah. It's like here, and then lower is the most pain. Wow.
There we go. Well done. You sure you haven't done this before? You were so calm, and we got everything in there. Hi, Abby.
Hi.
Good to meet you today.
Yeah.
So Abby's a new patient who, like the patient before her, is also an RMT, which means that she has been breaking her body, helping others. So I'm going to let her kind of talk us through what she's been dealing with both during schooling, because you just graduated recently, right? So congratulations to her, and what she'll likely be continuously dealing with going into full-time practice. So Abby, why don't you take us away?
Yeah. So I mostly tend to complain about low back pain. Yeah, I just always feel pain around like the low back area, and sometimes just because of school, because of studying. Obviously, we were using the computer and typing. I had like some upper trap pain as well, so upper back. Yeah, and then I have some postural imbalances that contribute to those things, but that's basically it. It's pretty aggravating sometimes. When I walk, I actually get pain in my low back as well.
Is that on one side, or is it really like
it's kind of like in the middle, I'd say.
Right.
Yeah, so when I'm walking, I actually tend to feel a lot of pressure on my low back.
Okay.
And that's pretty annoying. So, yeah.
Pain is definitely a big annoyer, and is the reason that most people will initially present to a chiro or an RMT or a physio for whatever reason. They're going to need that spur. Best approach you can do is be proactive with these things and take a strengthening approach beforehand. That way these things don't develop. But if they do, we can absolutely play whack-a-mole with the symptoms too. Now, you were saying that upper, kind of that study posture. Let's talk about the upper back a bit here.
Yeah.
You mentioned your shoulders were pretty messy. So what's going on with those?
Yeah. So I have like some crepitus, just like some cracking around like the shoulder area. I didn't experience that until after school. So thank you, school.
Thank you, college. Appreciate that.
Yeah. So I feel like, or maybe I wasn't aware until like a college happened. So but I'd say it made a lot of my issues worse. I didn't have time to, do massage, things like that. I was the one that was helping others, right? So so now I'm like, I can finally get help.
Yes, you can. You come to the right place.
Yeah.
So anytime we have a shoulder, a neck, or an upper back complaint, the two that are not involved will become involved. Okay, those three regions are very anatomically and biomechanically linked together. When there's an issue with one, the other two will start to move improperly to compensate for that, and suddenly the whole triangle's kind of out of whack. So we'll try to take care of that today as well. So we got lower back, we got upper back, we got shoulders, we got neck. Any other? I think that's what we want to cover, right? That's everything. Look, awesome. So today we'll be doing a physical exam, and then we'll be getting into the treatments. Do you have any questions, comments, or concerns about those things before we get into them? No? Awesome. Neck, Rob. So we're going to start with your neck range of motion here. I'm going to get you to bring your chin down to your chest for me. Any discomfort in the back of the neck, the shoulders, anything through there?
Just a little bit in the middle.
A little bit kind of smack in the middle at the base there, or up higher?
Just, kind of around like here, yeah.
So she's pointing kind of to her whole lower C-spine region. Let's go ahead and push that further. Any discomfort?
No.
No? Okay, come back up. I need you to look up to the ceiling for me, please. Anything?
No.
No? Okay, I'm going to go further. Anything?
No.
Okay, face forward. Rotate your head to the right, please, as far as you can. We've got 80 degrees. Now rotate to the left as far as you can. We've got 80 degrees. Good. Face forward. Bring your ear down to your right shoulder. That's okay? Good. Now this ear to that shoulder. Oh, you got to pull down through that region?
Here, yeah.
Okay, now this ear to that shoulder. Good. And pain on this side?
Same thing, yeah.
Okay. So that's really the upper traps region. The trapezius muscle is that big kite-shaped muscle on our back. In students or anybody who works at desk, hunch over, get real tight in the top there, and that's what I'm feeling here, which is further emphasized by the lateral flexion of her neck. So I want you to stand up for me.
Okay.
I want you to turn and face the skeleton over there. Good. And now I'm going to get you to bend down and touch your toes for me, okay? Any discomfort in the low back with that?
No, just hamstrings.
Just hamstring tightness, okay? Now I want you to come back up the other, extend backward the other way. Any discomfort with that?
Yes.
Where?
Like all throughout.
So kind of like throughout the center, and so not just here, but also up higher too.
All through, yeah.
All right, so she's pointing kind of to her entire lumbar region, all the way from L1 down to like the SIs almost. So we'll take a closer look at that. You were saying you're feeling kind of equally on both sides of the lower back, right? Okay, so I'm going to start just with your right side and take this leg, and I'm just going to lift it straight up as high as it'll go. And we're kind of limited already. Are you getting back discomfort or hamstring tightness? Hamstring tightness. The great thing about working with other people who work in like a kinesiology related field is that they know the anatomy when you say these kinds of things. All right, so that's about as far as we're going, which is maybe 60 degrees. Like you should just slowly lower this leg down yourself, slowly lower it down yourself. Any back discomfort with that?
No.
No? Awesome. Okay, we're gonna do the same deal on this side. Bring this up as high as it will go. This leg goes significantly farther. We're up to about 70, almost 80 degrees. Any discomfort with that? Just the hamstring? Okay,
yeah.
now slowly lower it down once again, please. Slowly, slowly, slowly. Anything in the back with that? No? Awesome. Okay. So I'm going to bend the knee, roll you this way. Hand's going to go behind your back. Okay. And I'm going to push through your thigh. Any discomfort with that?
Like on the glutes.
On the glute region.
Yeah.
Okay. And now, same deal on this side. Bring this over. Any discomfort with that?
The glutes.
Glutes again? Okay. Hips. We're going to bring this up. Ooh, look at that. Free pop. So any discomfort with this?
No discomfort.
No discomfort? Okay.
Usually this one just always cracks.
Fair. Let's see if it happens on this side too. This one's good. Okay. All right, my hands are coming in on your back now, okay? Yeah, lots of tightness up in through the upper traps, but that's very common in anybody who's a student or corporate worker. How's that right there?
Yeah, it hurts.
A little gross, right? Yeah. Yep, it's great, Adam. Thanks, yep. Tension there, in through the TL junction once again, where the upper back becomes the lower back. And it's kind of tight on both sides. Not sure, there might be a little bit more on the right, but they're pretty close. So SI joints, bottom of the spine is your sacrum. Connecting to the sacrum are your hip bones or your iliums, all right? Your ilii, I don't know how you say plural, ilium, whatever. SI joints are the joints between them, the SI sacroiliac joint. So just me, or is it the left side that feels more stuck than the right?
I find the left side, I think, is stuck, actually.
That's the one that you feel it on more so as well?
Yeah.
Look at that. These hands don't lie. So while you're in this position, I think it makes the most sense to kind of adjust in through the upper back, okay? Then we'll examine the neck, take a look at that, and then we'll also do the low back following, okay? All right. So have you ever been adjusted before?
No.
No? Oh, first time. Exciting, exciting. So it's a very simple process. You know how earlier I was kind of doing this up here? It's that, except it's going to be a lot faster,
Yeah.
okay?
Yeah.
So what I need from you is to take a big breath in for me, please. And all the way out, all the way out.
Oh.
How was that?
Yeah, it's a lot. That was like so many cracks.
I can hear them. It was good.
Wow. It was good.
That was good. Those were pretty vocal as far as upper backs go.
Yeah.
Yeah.
I feel like I'm used to it now with her.
Yeah.
I'm just like waiting for the cracks.
Yeah. Breath in. And all the way out, all the way out. Okay, nothing there. Actually, I think there might have been a small
was
one.
some,
I'm not
yeah.
sure. Okay. And do the other side of the base of the neck there. I'm just going to flop your very
Yeah,
long hair
my
over
bad.
here. You have nothing to be sorry for. All right. And relax. Breath in. And all the way up. All the way up. Good. There's a good one. As we were saying before, anytime you're having an issue with shoulder, you also need to address the upper back and neck. We've addressed the upper back. Now we're going to take a look through the neck. All right, so definitely the right side is tighter than left. So with you, I'm feeling a lot more tightness in the lower aspects versus the top, which checks out considering your problem is really stemming from that shoulder. So. Get you to turn your head as far as you can to the left, please. Good. And then just drop into my hand as if it's a pillow. Good. Go from that.
Oh my gosh. I can't. Wow, okay.
Well done.
Thanks.
I heard you breathe in and breathe out of your own accord. I was like, we're taking advantage of that. That's good.
Okay.
Good. How was that?
It was good. Yeah, it felt very good.
Awesome. So, and it feels significantly better down there to me now too. So let's go ahead and feel through the left side.
Yeah, there's a lot of pain.
There's pain through the left side. Huh? No problem. And through the lower aspect there, right?
Yeah, lower aspect, and I think also like
As I'm
up
getting
as well.
higher.
Yeah, it's like here, and then lower is the
Okay.
most pain.
All right. We'll target those regions. Let me move the microphone. Good. Okay. So for the top, I'm going to get you to turn your head as far as you can to the right for me, please. Good. And drop once again. Good. Breathe out. Nice. So I think that actually got this side. Let's get you to turn as far as you can to the left.
Okay.
Good. And relax the head. Good. Drop, 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 drop. Good out. Here we go. So that got the very top on both sides. Now let's check lower down on the left. Good, to the right. Good. Breathe in and out, all the way out.
Wow.
There we go. Well done. You sure you haven't done this before? You were so calm and we got everything in there.
Well, literally.
She's crazy.
Alright, now you're close to the right position. I'll get you to, slide your hips towards me to start. Yeah, come a little closer. There we go. I'm going to take this, I'm going to pull, and arms just like that. Good. We're going to bring this hip up. And once again, a little bit closer, please. Good, awesome, and relax there. Perfect. Now, I want you to take a big breath in and all the way out.
Oh my gosh.
That was a really good release.
Oh
Relax, close.
I feel like that's what I've been trying to get out of you for like 2 years.
2 years.
I'm always working on your
Nope.
side.
Similar, but I'm going to actually take this arm and I'm going to pull it so that you're kind of like rotated, upper back almost flat on the table. Not quite, but there we go. You're going to hold right there. Perfect. We're going to bring this leg up and you're going to scooch the hips towards me, please. Perfect. Awesome. So holding, hold the wrists. There you go. All right. So breath in, all the way out. There we go.
Every time it's like I'm not surprised, but I am at the same time.
You know what's coming.
Yeah.
So with this, you can expect to get some redness. Okay, it's called petechiae. It's nothing to be concerned about. It'll go away within 72 hours or greatly improve. Okay. All right. Any concerns about that?
No.
No. Perfect. So we'll start with the lower back.
Feels like ice.
Yeah, it is a little cold. How'd you find all of that, Abby?
Oh God. It was amazing.
Oh, thank you. I like that a lot.
Yeah, I would definitely come back again. I recommend to everybody to get a chiropractor or to find him.
Oakville, Ontario.
Yes, because it was amazing. I think just feel relieved. I feel like I'm in bliss.
So, those are big words. If I can ask, what was it that you found the most relief from? Because I did a variety of things.
Yeah,
with you.
there was many techniques. Oh God, it's hard to pick. It is kind of nerve-wracking at first with like the adjustments because it is very fast and like just like rapid, but after it just feels like a huge relief on the body, so that was really nice. But I also really like the treatment. I don't know what that was called.
The tools that I was using?
Yes, yeah.
So that's referred to as instrument-assisted soft tissue therapy, but I kind of just call it sports massage because that seems to resonate a lot more with the internet as well as just patients. They kind of have a better idea of that.
Yeah.
But so it was kind of like the combination. There wasn't just one thing, right?
Yeah. Yeah. No, I really like that at the end. I just felt like it kind of it just put me into that bliss. Like kind of feel like okay, like I've already gotten a lot of relief in my body, and that was just like the perfect end. Like even though there was pain and things like that, it was like worth it.
Good,
so
thank
I
you.
feel really good. So thankful.
Happy to hear.
Happy I was here.
So
yeah.
She's described multiple techniques, which is why I always emphasize a lot on this channel that diversified practice is the best way to go. That's where you get experience in multiple different fields from one practitioner, right? So again, here, chiro, massage therapy in some senses, the sports massage, do a lot of physical therapy and acupuncture as well. But having tools can be very beneficial to each individual patient, right?
Yeah.
So thanks for coming in today.
Thank
We
you
can
so
end
much.
on a high five and we can call
Thank
it.
you. Don't forget to like, comment, and subscribe.
Thank you, Abby.